Hi everyone, my name is Innocent Grant, community reporter from the FPNN. And as we all know, this week we're going to attend the 9th African Population Conference taking place here in Lilongwe, Malawi. Ahead of that conference, we had a power shifting pre-conference, which is more focused on how can we shift the power and enhance equitable demographic research studies in Africa. One of the participants is joining me today at the FPNN. I'm going to give her an opportunity to introduce herself, and then I'll be asking her questions so we can get to learn what happened during the power shifting pre-conference. So welcome, and please introduce yourself.
Great, thank you. So my name is Barwani Msiskai, and I work with IREX in Malawi, and I work as the activity lead. Yes.
Thank you so much, Barwani, for that introduction. I think my first question would be, what did you learn from today's power shifting pre-conference? What stood up?
I think for me, what really stood up is a couple of key questions. To say, as we are talking about power shifting and looking at research, we should really ask to say who is there, who is on the table and who is not. Also, when we look at research, what is the actual research pipeline? Are we talking about data collection? Are we talking about analysis? Are we talking about how collaborations are designed, implemented, and what is the outcome and use? So I think for me, when I look at it, was really looking at that full scale and also looking at how do the power dynamics play? Are we looking at south-south or north to south? And are those shifting over time? And I think one of the things that came up a lot in the conversation is there are a lot of bright spots, but are we identifying the bright spots and putting the money where the bright spots are to like upscale and like magnify, or are we just having the same conversations and not really moving the needle forward? Yeah.
Interesting. One angle that I want us to talk about is reproductive health, sexual reproductive health. And I just want us to link it to today's conversation. Earlier, before the pre-conference started, the moderator shared about the historical background of demographic studies in Africa and how that was being colonial, driven, and so much colonial perspective to that. And I believe reproductive research linked to demographic studies also has shaped the way we see reproductive health narrative in Africa today, where we see there is a lot of resistance from the African governments in terms of amending policies, creating safe environments where we can have better reproductive health outcomes. Where do you think is the way forward in terms of enhancing equitable demographic research studies for better reproductive health outcomes?
Sure, so that's such a great question and so loaded, but I love it. So I think like something somebody said who I was sitting with, they were talking about, there's an issue about credibility. To say when we look at demographic studies or just reproductive health data, who do we trust and why do we trust one piece of data and why don't we trust the other one? So working backwards, I think the question is, who prescribes that? And why does that, who do we leave behind with that set? So maybe I'll give an example practically of the work that I do. So also in my work, I should say I'm a family planning or contraceptive enthusiast and champion. I believe that if you have young people defining and describing and deciding when and how they have sex, but also the services they access, that does the shift. And I think even when we're talking about demography and research, the thing everybody we come to is that demographic dividend. And we all know that that sounds very lovely, but it needs a lot of investment and long-term investment. So in the work that we do at IREX through Youth Excel, we looked at the issue of trust and accountability, but also looked at where are the people that we're really talking about. I think when we talk about a lot of SRHR, you look like you're going down to adolescents. So this could be your early adolescents, but also adolescents, at different circles of the life stage and the young people. And then the question is, if you look at young people, you find that they're at the front lines of the work that they do, and they're collecting a lot of nuanced data. But then that data, if you bring it to the table, the first thing will be either we don't trust the data, it's not representative, but that does not take away from the richness of the data. So like with the work that we do, we said, how do we then bring the young people that are already doing the work, but how do we bring in research into the work in a way that nurtures what they're already doing, but gives them, they understand the concept, they understand the processes, so that now even the data that is being developed, when you come back to the table, they are the credible experts. So it's not just the lived experience, but they've collected the data. And if they work at committee level, there are so many opportunities at that level to drive and shift that conversation. So now you're moving from we collect data and we do the activity, or we're just coming to the table to share, but now you're seeing a young person not also just as a young person, but they're coming in the room as an expert and a collaborator who has the power. So I think it's also, for me, when we look at history, is that shift, is happening at different stages. But I think for me, it's also good to look at that stage and then, move that needle across. So now then you have a young person providing a product, a young person questioning, coming to their system to say, either it's at a district level, at a county level, can we make these changes, and doing it together. And we've seen that here you also have like big key stakeholders in the country who can be funders or ING who have actually said, oh, we do have this data, but we didn't understand what's driving it. So now you're actually having those people that usually are on the margins coming together and really working together. So what that is also doing is showing that it can be done and how it can be done and accelerated. And I think just the touch to that also is the issue of sustainability. Because I think a lot of things, research is always like, money flows in, but how do you keep it going? How do we also institutionalize the pipelines of the data that we have? How do we use the data that has existed? So a lot of times, I think sometimes we collect a lot, but because the use is not there, and we have a lot of routine data, but we're just not using it the right way and making sure it sits there long term, that can also reduce, maybe now you spend lots more money, but for example, like when you look at Scandinavian countries, because they collect routine data all the time, they don't have to do big surveys because that data is there to pull on. So also looking at our systems, like, and I'm going to use the African context because we are at the African Population Conference. You see that also in a lot of universities of African countries, people have begun the process. Some are more advanced, some not, but also looking at how do we collect that data routinely. But instead of just looking at that data, also just looking at existing processes. What is already there now? How can we, small steps, start producing something, but that will change how we understand the data and also apply it to decision making. Yeah.
Thank you so much, Barwani, for that. The quite interesting conversation at the last plenary of the Power Shifting Conference, and that's around, when we talk about power shifting, we also talk about money, resources. And one of the panelists said, power shifting comes with accountability. And one of the things that Professor Jacques from the University of Kinshasa mentioned is around governments actually mobilizing resources to support their country's research, their research institution within their own countries too, And that came in my mind in sensitive issues like reproductive health. And when research studies are actually funded by external donors, there's a big cut of trust that you've already spoke about. So I'm a young researcher, but funded by an external donor. I generate evidence saying, when we provide right information to young people, we actually reduce sexual reproductive health, poor sexual reproductive health outcomes. But the government will say no, because they didn't fund that. They think it's a Western agenda. They think, how do we make our government accountable in mobilizing resources for sensitive issues and generate more evidence that can translate to policies? I believe that's also a big question, but I'm trying to make it simple.
I like how you think that made it simple, but okay. So I feel like, I have sat, so I'll give my personal examples, but also maybe some of the bright spots I've seen that sometimes you walk in a room and everybody is already an ally, but sometimes that's not the circumstance, and that's the truth of the issue. But at times when you have one ally, you can also work with government to be part of the core design. So in opportunities where that one ally is, if you have them as part of the core design, the first steps is you're having everybody buy in. one is to remember that takes time. And sometimes then the second thing is, if you want that buy-in, is to map to say who has influence over innocent or over somebody in the room. How do we also work with them to nurture a relationship that, you know, can build that higher buy-in? Because as you say, it does not make sense for, and it's really frustrating, and that can be frustrating, like you have, you know, invested anything and then something is just shelved. So it's also to say, how are we working together, but also using our allies and people of influence to build more influence so that it has acceptability. And I think that buy-in also helps us that even after the use and the influence of the data becomes greater. And I think, yes, the issue is government, but sometimes also our systems are funded by different funders. Sometimes every funder, you know, you also need buy-in from all the funders. Instead of doing maybe the same research, but working with 4 different institutions, how do you pull in the resources and drive the agenda? Because that also means as a community, you are all pushing one thing. I also find that when you're building that trust, it's also good to look at what is your end goal. So we all know that if we invest in SRHR for young people, you're making sure that people transition to adulthood. If we look at our current economic downturn, that means that young people are creating jobs, young people are able to provide for themselves, they seek healthcare, they are educated. All those are great gains. So I think we also need, as we speak and we have an investment case, we also need to put a clear investment case for shifting the power where it's working, to also see like, how much money does that save the government? How much does that make government become more, you know, the governance, but also on the agenda? So I think we also need to ask ourselves to say, is in how we're designing and implementing, giving that power to government or people that have the mandate to really lead, or are we giving it to somebody who has a 5-year project? Then it will end. So it might look like you had buy-in, but it was around that 5-year project. But we are not, so it's like we're making small steps, but not really shifting that step in the system. So I think there's also, I always say, every time there's this, I'm always saying, aren't we the problem? What are we doing to fix the greater problem as well? Yeah.
Well, Barwani, thanks for accepting talking to me, but also being vulnerable to talk about these sensitive issues.
Yes.
I hope we can get to talk again next time.
Sure.
Asante sana.
Thank you so
Zikomo.
much. Yes, exactly.